Struggling to control high blood pressure? Hydralazine might be the answer. In this video, we'll break down everything you need to know, how it works, common side effects, and expert pharmacist tips to use it safely. Let's get started. Hydralazine uses side effects and pharmacology explained. What is hydralazine? Hydralazine is a prescription medication primarily used to lower high blood pressure, also known as hypertension. While it's not typically a first-line treatment, it can be a valuable option when standard blood pressure medications are ineffective or not well tolerated. Hydralazine is generally taken multiple times per day, and the dosage is highly individualized based on a person's response to the medication. Hydralazine is available only in generic form as an oral tablet. There is currently no brand name version on the market. Common side effects include headache, gastrointestinal discomfort, and elevated heart rate. What is hydralazine used for? The primary approved use of hydralazine is for the treatment of high blood pressure, hypertension. In some cases, it may also be used off-label in managing heart failure, especially in combination with other medications such as nitrates. How does hydralazine work? Hydralazine belongs to a class of medications called vasodilators. It works by directly relaxing the smooth muscles in blood vessel walls, particularly in the arteries. This relaxation allows blood to flow more easily, thereby lowering blood pressure and reducing the workload on the heart. Hydralazine dosage forms and pricing. Hydralazine is available in tablet form and is generally considered a low-cost treatment option. Here are typical retail prices for a 90-tablet supply, which can be significantly reduced using pharmacy discount programs. Strength quantity lowest price per tablet. 10 milligrams, $94.04. 25 milligrams, $94.04. 50 milligrams, $94.04. 100 milligrams, $18.24, 20 cents. Typical hydralazine dosage guidelines. Treatment with hydralazine generally begins with a low dose that is gradually increased. Initial dose, 10 milligrams orally, for times per day for the first 2 to 4 days. Week 1 adjustment, often increase to 25 milligrams 4 times daily. Maintenance dose. From the second week onward, the dose may be raised to 50 milligrams 4 times daily, depending on blood pressure response. Maximum dose, up to 300 milligrams per day, although most patients do not require more than 200 milligrams daily. Dosing may vary depending on individual patient needs and recommendations from clinical guidelines, such as those from the American College of Cardiology, ACC, and American Heart Association, AHA. Healthcare providers tailor the dose to achieve the lowest effective amount for controlling blood pressure. Other forms of hydralazine. In addition to oral tablets, hydralazine is also available as an injectable formulation. This version is administered by a healthcare professional either intravenously or intramuscularly IM, typically in emergency settings or during hospitalizations for acute blood pressure management. What are the side effects of hydralazine? It maintains professional tone and is optimized for the target keyword hydralazine. Side effects to improve searchability and viewer engagement. What are the side effects of hydralazine? Like many medications, hydralazine may cause side effects. While some are mild and may improve as your body adjusts, others may require medical attention. Always consult your healthcare provider if symptoms persist or worsen. Common side effects. These are the most frequently reported side effects and are often mild to moderate in severity. Headache, nausea, vomiting, diarrhea, loss of appetite, rapid or irregular heartbeat, palpitations, chest discomfort, or mild chest pain. These effects may become less intense over time. However, if they interfere with your daily life or persist beyond the first few weeks, speak to your healthcare provider. Other possible side effects. While less common, the following side effects have also been reported: constipation, dizziness or lightheadedness, low blood pressure, hypotension, tingling, burning or numbness in the hands or feet, peripheral neuropathy, flushing or warm sensation in the skin, rash or other mild skin reactions, difficulty urinating. Monitoring your symptoms during treatment helps ensure early detection and management of potential complications. Serious side effects. Seek medical attention immediately. In rare cases, Hydralazine may lead to more serious health concerns. Contact your healthcare provider or seek emergency care if you experience heart attack symptoms, including severe chest pain or pressure, shortness of breath, cold sweats or unexplained nausea, pain radiating to the arms, jaw, or neck. Any signs of serious cardiovascular event must be treated as a medical emergency. Pharmacist tips for taking hydralazine. To get the most benefit from hydralazine, it's important to use it safely and consistently. Here are essential tips from pharmacists to help you manage your treatment effectively. 1. Be consistent with food intake. Hydralazine can be taken with or without food, but consistency matters. Food can affect how much of the medication your body absorbs. So, choose one approach. Either always take it with meals or always take it on an empty stomach, and stick to it. This helps ensure a stable level of medication in your system. 2. Monitor your blood pressure. If you're checking your blood pressure at home, keep a daily record of your readings. Share this information with your healthcare provider, especially if your blood pressure hasn't improved within 1 week. Your dose may need to be adjusted to achieve better control. 3. Prevent dizziness when standing. Hydralazine can cause a sudden drop in blood pressure when you change positions from sitting or lying down to standing. To prevent dizziness or fainting, rise slowly and give your body time to adjust. This side effect typically improves within a few days. If it persists, let your provider know. Your medication regimen may need to be reassessed. 4. Watch for lupus-like symptoms. Notify your healthcare provider if you notice any of the following: fever, rash on your cheeks, joint or muscle pain. These may be signs of lupus-like reaction, a rare side effect linked to hydralazine. In such cases, your provider may recommend a different medication. 5. Follow up with lab tests. Hydralazine can occasionally lower both red and white blood cell counts. This may cause symptoms such as fatigue, dizziness, increased risk of infections. Routine blood work is essential during long-term use. It helps detect any changes early and allows your provider to make necessary adjustments to your treatment. 6. Miss a dose? Here's what to do. If you forget to take a dose and it's almost time for your next scheduled dose, skip the miss one. Take your next dose at the usual time. Do not double up. If you're uncertain about what to do, consult your pharmacist or healthcare provider. Learn more with HeInfo. Want clear, doctor-reviewed videos on how to use medications like hydralazine safely and effectively? Subscribe to HeInfo, your trusted source for evidence-based health education. Explore our playlist on heart and blood pressure medications. Empower your health with knowledge, one video at a time. Subscribe now and stay informed.